Hi, everyone. It's just gauging me today, so sorry. Kind of a disappointment, I know. I hope everyone's doing well on Good Friday. So I'll dive in. Currently, we have 140, or I'm sorry, 473 cases. Typically, this number jumps up a little bit later in the day, so I suspect that number to change probably in the next couple hours. But right now we're at 473 cases, still at 14 fatalities. I mentioned nursing homes yesterday, and the two nursing homes that we're concerned about. One is the Grimes Center, which is affiliated with Yale Hospital, and there have been 49 residents that have tested positive at this site. And the second is Mary Wade Home in Fairhaven, where 10 residents have tested positive. Our health department has been in ongoing contact with both groups, and they're working very hard to address the problem. And I was on a conference call today as well with our health departments, the Mary Wade Home, and the state to talk through how they can mitigate any risk of further transmission. Um, in these conversations, it's clear that both nursing homes are working very, very hard and doing their best to follow the guidelines as to what they can best do to make sure that they're protecting their residents. It's a very, very challenging situation, but we're happy about the collaboration with the two entities. A few more updates. We got 10,095 masks from the State Department of Management, or the State Department of Emergency Management and Homeland Security, and we're really excited about that. As you will recall, 2 weeks ago, I put out a call for N95 masks because we had such a lack of them, and so this will provide us a significant buffer as the cases continue to rise to protect our public safety officers. Police and fire numbers. So the fire department has 10 positive cases now, and the police still has 4. Again, one of those police officers is already fully recovered, is asymptomatic and back to work. We have 2 individuals at Career High School at the isolation shelter, and that's working well. And then something that is almost entirely COVID unrelated is the closure of the Grand Avenue Bridge that will be starting on Monday. There will obviously be some significant traffic changes because of that. We'll be putting out messaging over the weekend and a robocall, but it would be helpful if the media also got the word out about this, just so residents know who are used to going down those routes that they'll have to change their traffic patterns to get to and from. Generally, there's not a ton of traffic nowadays, so it won't be as much of an inconvenience as it usually is, but we just want to let people know. Final thing, excuse me, final thing that I don't have a lot of details on yet because it's mostly a state initiative, but the governor announced several days ago a collaboration with CVS about standing up a testing site, and New Haven is one of the cities where they're working to do that. And our team is in conversations with the state about the site and the details around this testing facility. And so I think it's important to stay tuned on that. And also, just in general, my strong opinion is this is a great step forward for us to significantly increase the testing. If we are able to dramatically increase the amount of testing that we do in Connecticut, in connection with contact tracing, that's the way that ultimately we're going to be able to get this thing under control. And so I'm very grateful for the governor's leadership in understanding that testing is a major priority and standing up this site in New Haven. Any questions? And I will do my best to answer them, given that a couple of other folks have a day off today. Mary, go ahead.
On the CVS, do you know how they were going to do that? Is it another facility they'll put outside, or people just sort of line up in the drugstore to get it?
No, my understanding is that it will be a drive-through site.
Oh,
Their intention is to test many people each day, and that it will not be in a CVS, that they're looking for an alternative sites that are easily accessible to many people who are driving.
okay. That's great. Is and it just, I mean, I guess we can't hope for everything, but just one. There's a lot of CVSs in the city, but just one site.
Yeah, but again, the intention is not to use an existing CVS. It's just, my understanding is it's a partnership with the corporate CVS entity to stand up this site, but it will not be at a CVS store. They're looking at alternative locations
Okay,
that will be a drive-up location.
okay.
Um, while I think this is a very, very positive step forward, one of my concerns is that for people that do not have access to a car, it's difficult to get tested. And in general, of course, we don't want to encourage people that might be symptomatic using public transportation. We don't want to encourage them to use an Uber or a Lyft or a taxi if any of those vehicles are not equipped to handle a situation where there may be someone that is symptomatic for COVID-19. And so that's something that we're having discussions with about either potentially standing up other smaller sites around the city or trying to identify ways to transport people who need testing but don't have access to their own cars.
All right, so that's something the city itself would figure out with CVS. I mean, I guess conversations with them.
So the state is working on the collaboration with CVS. And I think that any more questions related to that specific project, you should probably ask the state because they are much more kind of in tune with the details there. We are concerned on the city level about making sure that all residents have access to testing, easy
Mhm.
access to testing, and low barriers to getting tested, because we think that that's ultimately going to help us um, get the virus under control. And for those residents, which is a lot in New Haven, that don't have access to their own vehicle, we're trying to determine other strategies to make sure that we provide them with adequate testing.
Okay, just one more. Do you know they have to do the usual routine, which is to call your doctor, get an actual, recommendation that you get a test, or would it be easier than that?
I don't think those details have been released yet. I'm not aware of what their strategy is going to be.
All right, thanks.
Yep. I see Tom.
Thank you. How will the 10,000 new N95 masks be used by the city? For public safety officers or?
I can't give you, so the short answer is yes. We have looked at both fire and police and their burn rate, meaning how much they use per week, and are anticipating the burn rate going up significantly as the number of cases increase. And we've already seen the number of cases increase each day significantly. And so we're very happy that we have a buffer to allow us to get through this time. We'll be analyzing whether or not we triage this to other entities in the city. Certainly, there's other workers in the city that are also on the front lines in different ways, like Board of Education member or New Haven Public School staff that is distributing food. Groups like that as well. So our fire department is taking the lead with the chief administrative officer on triaging the N95 masks and distributing them.
What specific recommendations did your administration provide for the Grimes Center and for Mary Wade about how best to mitigate the spread of the pandemic at those nursing homes?
So I can give you some generalizations. The health director's off today, which she really deserves a break. And she'll come back running even faster, I'm sure, tomorrow. But in general, we and the state, and ultimately the state is the lead on regulating nursing homes. But we've all been advising on how to screen the healthcare workers when they come to work, take temperature, ask detailed questions to make sure that the healthcare workers are not symptomatic, making sure that the healthcare workers and the residents are wearing masks at all times to make sure that residents reduce their likelihood, even if they're asymptomatic, but potentially COVID positive, of spreading the disease. Of ensuring that there is adequate cleaning of congregate bathrooms. In a couple of circumstances, there are congregate bathrooms or bathrooms where multiple people will use the same bathrooms. And so we're advising on making sure that there's staff that monitors and makes sure that people are only using bathrooms one at a time, and they're cleaning them in between usages, cleaning equipment that may be used in multiple rooms, like a blood pressure cuff, for example, cleaning equipment adequately. There's making sure that if there is someone that is symptomatic or tests COVID positive, and in many cases, the individuals that have tested COVID positive are now in the hospital, but if there are individuals that are COVID positive, that they are not interacting with any other residents in the facility. So there's a whole list of different recommendations. The specific entities, the state, and I can tell you on this call I had this afternoon, asked very specific questions of Mary Wade and gave very specific advice depending on different circumstances. And so that the state was very helpful in walking Mary Wade through any specific changes that they might make. And Mary Wade was very collaborative and already on top of many things as well.
Thank you for that. I would say that was more than general. I think that was pretty specific. So thank you.
Okay, good.
This may be more of a question for the police chief at a future meeting, but I'd like to pose it now in case you can answer, or just to file it away. And I know I asked a few weeks ago about this, but as prisons and jails around the country become a real focal point of attention for many concerned about the spread of the coronavirus, I think the place in the United States, maybe even in the world, with the greatest concentration of COVID cases is the Cook County Jail in Chicago. These seem to be pretty dangerous places for COVID right now. What are your thoughts right now in terms of how to handle people detained in New Haven's lockup, and what you immediately have control over, how to handle custodial arrests, and what you would advocate for at the state level around release or retention of prisoners?
So I can answer some of this, and the chief and I have had, it was maybe 4 weeks ago, or just when this this thing really started ramping up, conversations about how to keep people safe in our lockup. And as people may know, the lockup facility is small, and people generally only spend anywhere from a day to 3 days if it's a long week in a lockup facility before they're arraigned. And so people do not spend a significant amount of time in our lockup, but nevertheless, we've been very focused on making sure that we reduce the number of people that are in the lockup. So we're not doing as many custodial arrests, and have reduced the number of people in general that are in the lockup facility. And that number has gone down pretty specifically. The chief has shared that number in the past. I can confirm it. I think previously, there was an average of around 13 people in the lockup, and about 2 weeks ago there were an average of 3 that week. It depends on the week whether there may be a significant instance of crime where the number may go up a little bit, but overall, compared to the average number in any other year, the average number now is significantly down. The health director did a walkthrough of the lockup with the chief several weeks ago, and gave recommendations on increased cleaning, on separating individuals away from each other. And since we don't have as many people in the lockup, it's easier to do that. And they also had a plan for being able to potentially separate someone out further from the rest of the individuals that might be in lockup if they did test positive for COVID-19. My general sense is that New Haven is not a significant problem here, and our facility is very small. And it's also important to remind people that the Whaley Avenue Prison is a state-run facility and is not under our direct control. I think that the decision to release nonviolent offenders of low-level offenses is a good one. And our concern is being able to handle what we anticipate being a number of people that will be coming out of prison that will potentially be homeless or require other support. And we want to make sure that we're able to respond to that situation. And so we're having conversations with our reentry department to make sure that we will be able to provide the resources that we need for people that may be coming out of prison. As the people on this call know, we've been working very hard in particular to facilitate protections for the homeless population, and the potential for us to have more homeless individuals is something that will require more work to make sure that we're protecting those individuals as well.
And I just respectfully request at a future meeting that someone from reentry maybe come on to provide a bit more details about what that department of the city is doing, if that's possible.
Yeah, sure. So I would say that we just, because the governor recently announced that there was going to be some release of prisoners, that we are just starting to have these conversations about how we're going to respond. But
Understood.
happy to do that.
Great. And that's it for me. Thank you so much.
Yep. Other questions? I see Mary, but is there anyone else before we go back to Mary? Oh, Kyle, sorry, or Shayna, I'm sorry.
Can you hear me?
Yeah.
Okay, sounds good. Thank you, Mayor. Just a question for you as far as, Easter is obviously upon us. Good Friday's today. There are many churches out there that are obviously hurting, especially local churches, smaller churches in the area. And I've spoken to a few pastors that tell me that they don't feel their church is going to survive this pandemic. I know there's, support for small businesses. Has there been any conversations about support for local houses of worship, given the severity of the pandemic and how it's impacted so many people?
Yes, there is some support for churches. I was just going to look up the information while we talk. I might be able to find this for you. But we did, so we put out an email to many local churches about some of the stimulus that's available for local churches. Obviously, this is a major challenge for churches because many churches are reliant on in-person services to collect funding to pay for rent for the churches or salaries for staff. And online services is just logistically a little bit more challenging to collect funding. And it's something that we're aware of. And because not all of the support is available to churches, it's something that we've been talking internally at City Hall about what kind of gaps exist, right? And I mentioned in the past the undocumented population is one area that is not eligible for most of the federal subsidies, and churches are another area that are not eligible for most subsidies, but there are some. I'll try to find this information, and then I'm happy to share that with you.
Oh, great. Thank you so much.
Yep. Go ahead, Mary.
Just some more things maybe on the nursing homes. I guess the city must have already talked in depth maybe with Grimes. I mean, they have a bigger number of people that were, you've already gone through that with Grimes. Do you know how many people out of both of those facilities are actually hospitalized?
Hang on a sec. In Grimes, my number is 14 hospitalized. In Mary Wade, I believe it is 9.
9, okay, all right. And so the city is really stepping up to get in there and talk to people and advise them. So this sounds like it's unusual. I mean, usually it's a state person or a state facility people.
I think that,
is that right?
So technically the state is the gives oversight to nursing homes.
Mm-hmm.
But I think we all play a very prominent role in making sure that we're supporting our partners. And given that everyone is short-staffed, everyone is scrambling to respond to the virus, everyone is trying to react quickly to developing situations where a lot of the information is not available to everyone, right? The test turnaround takes some time. We didn't have a very well-developed way to monitor these situations before. And so that's why it's important for us all to work together. And just to give some examples of, there's a lack of PPE for a variety of our different partners. And on our daily calls with many of our partners, people will say, well, we've got 2 days left of gowns. Anybody have gowns? And someone else on the call may have a lot of gowns, but they may not have a lot of swabs. And it's us all chipping in and figuring out ways that we can help each other get through each day, which is, I think, that what we've got to do right now. And so on that specific question about nursing homes, we have relationships in some ways that the state doesn't have in the city. We have some ability to help that the state doesn't have, and vice versa. The state has a lot of wisdom and expertise and support that they can provide nursing homes that the city doesn't have. So we're all trying to do our best to make sure that we can affect the best outcome.
All right. So the people that are hospitalized, will they then go? I know the state was going to get other facilities where people that do had COVID in nursing homes would go to. So then they're separated from the rest of the population when they're out of the hospital. Is that where they'll go? You know?
So it's a little bit complicated. The short answer is that my understanding is there's no facility in the state that, I know that no facility in the state has been offered up to New Haven nursing homes as an alternative for COVID positive individuals to go. I do understand the state is working on that. The hospital will not release people back to nursing homes until they have done 2 negative COVID tests. And the intention with that is clear, that because nursing homes are a higher risk population, the hospital wants to make sure that anyone they're releasing back to nursing homes is safe and is not going to potentially spread this to other individuals. The other question is around testing. And as testing availability increases, I would anticipate more proactive testing of asymptomatic people in nursing homes. As we've seen, there are many people that contract the virus that are asymptomatic, and some people that may even be asymptomatic for the entire time that they have the virus. And it's important for nursing homes to have the complete understanding of everyone in their facility in order to get under control any potential spread. Currently, because we don't have the available testing, it's difficult for nursing homes to do that, but I anticipate that in the future that may happen. There's also some questions about within nursing homes having a specific wing that is for COVID positive individuals or suspected individuals as a way to separate out both staff and residents that may be at risk.
Okay, that's something in the future. So Grimes essentially is part of the hospital, isn't it? I mean, it's a rehab center.
I don't know exactly the relationship, but I believe it's a Yale New Haven Health program.
So where would you release them to? I mean, if they come out of the...
My understanding is it's a separate building. It's near the hospital, but it's a separate building that residents live in. And it's obviously different than the hospital, which, if someone goes to the hospital, they have a elevated medical situation. They may, in some cases, be in the ICU. And once they get better, we want to clear out the hospital beds where there's a lot more resources for people that are very sick, for other individuals. And so the question, I think, for everyone is going to be, as we have more cases, as those beds fill up, we need to start making more difficult decisions about how to control the spread of the virus while also clearing out beds for people that may be very, very sick and desperately need that kind of help.
Okay. You don't know, I mean, I can call them, but the percentage of the population that does have COVID in both those homes?
I would call them.
Okay. And anything else on another hotel for the homeless since,
No updates from yesterday.
okay. And how soon, do you know how soon the prison population will be actually coming back to New Haven?
I don't know the answer to that either.
Okay. Thank you.
Yep, I see David raising his hand frantically. Trying to unmute you.
Thanks. Sorry.
No problem.
Real quick question about the nursing homes. I know you gave out the numbers. By chance, do you know if anybody has died from those nursing homes?
I do not know the answer to that. I do not know the answer.
And also, I know you're using career for homeless people who test positive. Would you ever think of considering splitting up some of that space for people who test positive and elderly homes?
So we have thought about a lot of different types of scenarios like what you're discussing. And that is one of the reasons why we're continuing to negotiate with other entities in the city just to have more flexible options. And not to give a very lengthy response to your question, but we know this is a many month process. And if we're really going to get on top of the virus, we need to make sure that we're providing many opportunities for people to self-isolate. And so there's a lot of people that aren't able to effectively self-isolate, and we want to provide more places for people to go where they can feel safe. They can have some level of care that's not hospitalization. For those individuals that require hospitalization, they should go to the hospital. But they can keep their family members or other people that they may live with or close to safe. I think one thing also to note, and I sent out a robocall yesterday about this, we're seeing in other places, one of the main contributors to spread is people getting it from other people that they live with, mostly family members who may be caring for someone that's sick. And the evidence indicates that the viral load that someone gets is a strong indicator of just how bad their sickness will be. So in other words, if I shake your hand and walk away, maybe I will get a small number of the virus. But if I'm spending 18 hours a day caring for my loved one and getting a lot of the virus, it's more likely that I'm going to get much sicker. And so in other countries like Wuhan, it was more than 60% of residents got the sickness from a loved one. And so we've started to have conversations about how we can start to message to family members who may be caring for sick ones about how best they can protect themselves from getting sick, or at least reduce the viral load that they will experience when they're caring for a loved one. Because we think that's a significant way that we can also contribute to reducing the spread of the virus.
Thank you.
You're welcome. Any other questions? Go ahead, Mary.
Maybe just one more on the nursing homes. This is probably not the case because there's no place to put people, but if you're running a nursing home and there's a certain percentage or a high number of people that come down with this, is there any action taken against the nursing home? I mean, are people, there's two different ways. I mean, the people that are COVID would go to someplace, but then all the others that weren't would go someplace else because the nursing home just wasn't adequate. Or do we just have to deal with it and make it better at that site because there's really no alternative to it?
I think that's more of a question for the state than the city, because the state is a regulatory body. I would say that my thought is that unless there is a very egregious violation, now is not the time for us to be penalizing nursing homes for example, the number of cases that they have.
Mm-hmm.
Because while some of the spread is within our control, a lot of it is not. And we want to encourage nursing homes to share information, to report cases, to work very collaboratively with the city and state. And if we're aggressively penalizing nursing homes, if there are outbreaks, then we're potentially inadvertently creating a scenario where nursing homes would not want to share information, not want to report sick patients, not want their patients to get tested because they're concerned about being penalized.
Thank you.
Yep. Any other questions? All right, we'll go Shayna and then Kyle, I saw.
So any update on the information you said you were looking up as far as the church assistants? I don't think we ever got back to that.
I was trying to multitask, but I'm never quite good at that. Can I have Gage send something out afterwards?
Yeah, that'll work. That'll work.
Okay. I will do that.
Thank you.
Yep. And then I saw Kyle.
Yes. Hey, wondering if there is any connection between the gentleman who unfortunately passed away, he was in his 50s, that worked at a facility with lots of people. Wondering if he was connected to either one of these nursing homes.
I don't know the answer to that. And unfortunately, Director Bond's not on the call today. She would know a little bit more details on that.
Okay. That was it for me. Thank you.
Okay, I did just refresh our document. We have 488 cases and still 14 fatalities.
Okay.
Any other questions here? Any other questions?
Not sure if my raise hand button is.
Oh, sorry.
Is it okay if I ask?
Yeah, of course. Sorry, Mackenzie. Sometimes, even though you're right in front of me, you're all right in front of me. Sometimes I don't notice a raised hand.
No, that's totally fine. I was just wondering, in light of potential prison reentry, if the city has changed its initial goal of 300 hotel rooms at all. And I'm also wondering if the goal is to completely empty homeless shelters, or if the city is working at decompressing them so that there can be social distancing within the shelter, and then maybe leaving some of those hotel rooms open for people who are entering the system for the first time.
So I don't have a good answer for you yet. We still have the goal of 300, but we don't have a sense of how many individuals might be, whether the population experiencing homelessness will increase significantly. So I because that situation is kind of developing quickly. At the moment, we don't have a higher goal, but we may change that. As far as the homeless shelters, it's been a directive by the state to close them. And so as long as the hotel initiative is effective and working, we don't see a need to push back on that request by the state and reopen the homeless shelters, even if there are not that many people that are staying in them.
All right, thanks so much. That's all for me.
You're welcome. David, did you have your hand up again? No, you're just waving at a friend. Okay. Any other questions? Going once, going twice. All right. Thanks so much, everybody. Take care.